Getting ready for the ACAD, not only is this a technical exercise, but it's a business process exercise. We have engaged in person about 45 of the 120 local departments of social service. We've gone through a business process redesign, trying to bring best practices in. Imagine, if you will, that even 2 years ago, we had to determine 1.2 million Medicaid eligibility applications, make determinations on that. That is likely to grow no matter what. If you can do 30% of those automated, you're taking 400,000 right out of the queue. And so we are trying to help them adjust to this new way of doing business. Why this is important going forward is we replace the ADAPT system. Just to give you an example, Don Driver, who has been DSS since Harrisonburg, comes in with a stack of papers and says, "Doctor, 29 forms that we use for foster care." This is the Medicaid example. 29 forms, and we counted 70% of what we asked for was redundant. So the issue for us is not just hardwiring so that we can collect more useless information more quickly, but it's to actually cause a change in business process that makes our offices more effective. We've had monthly communications going out to the locals. We have had a number of conferences. We are trying to prepare a messaging for citizens in October 1st, and we anticipate there's going to be quite a bit of confusion. We know that the federal government has awarded the Federal Qualified Health Center $2.5 million for navigators to help people sign up for the federal marketplace. And we know that money was released this week. I know Bill's here, the Poverty Law Center got about $1.3 million in order to help with sign up. So we're going to need to coordinate our message. It's important that people go to the right place. If they don't, it's just going to overwhelm our local social service offices doing work that is not actually going to help anybody. The releases continue. The process for MAGIC begins really, or has begun. We will have that October 1st. We'll have the online guide release sometime in October based on what it is that we find. And then we have another series of releases, and we need to finish the MAGIC changes by the end of calendar year 14. That's when we lose the 90% federal match for that. Beyond that, though, this is just tentatively, I'll read it to you, 2013 and 2014 changes that will be made. And then in 15 and 16, we will be removing paper, hopefully making our local social service offices paperless as we go forward, and retiring the ADAPT mainframe. A couple of things that will come to you in the process that you get to make decisions about as legislators. Number one is call center. We have a call center for Medicaid. Do we want to have other call centers for the other programs, or do we want to use them as one centralized call center, trying to divide the level of work between what is centralized and what is done regionally? There will be some implications to that. From a budget standpoint, I think it's later we will see, for a period of time, we will be running the ADAPT system and the new system in parallel while we're making the transition. There will be some financial implication of that. We're paying $17 million a year for the old system, and we have to get that phased out. So there will be some budget items around that. I think that probably is a nutshell what I need to tell you for today on eligibility and modernization. Happy to take questions. Massey's going for the mic.